What if the pain in your lower back isn't just a sign of aging, but a quiet message your body's been trying to send you for years? Most people over 50 shrug it off. They say it's just part of getting older. But here's the truth. It's not age, it's adaptation. Your spine has been adapting to how you sit, move, and carry your life for decades. And now it's asking you to pay attention. That pinch when you stand up, the stiffness putting on socks in the morning, the ache that lingers when you sit just a little too long. It's not weakness, it's not wear and tear. It's a pattern, one that can be reversed, retrained, and relieved. In this video, I'm going to show you 4 powerful science-backed movements that aren't just stretches. They're neuromuscular resets, and they can help restore the natural balance of your spine sometimes in under 30 seconds. These aren't random exercises. They're carefully chosen to unlock one of the most overlooked joints in your lower back, the one that controls more movement and pain than most people realize. Before we get started, drop your name and where you're watching from in the comments. We'd love to hear from you. Let's dive in. Why most over 50s are treating the wrong part of their back. For millions of Americans over 50, lower back pain has become so common, it almost feels normal. But here's something your doctor may never have told you. The pain you feel isn't always in the muscle. It's often in the joint that stopped moving right years ago. Specifically, the lumbosacral joint. The very last joint in your spine is the most prone to get stuck, irritated, and forgotten. It sits right where your spine meets your pelvis, acting as a shock absorber for every step, every chair you sit in, and every time you bend to pick something up. Over time, small habits like slouching on the couch, sitting with your feet raised, or working from bed jam this joint out of position, locking it into a posture it was never designed for. You can stretch at your hamstrings all day, but if that joint stays frozen, the pain always comes back. We call this joint stacking, where years of uneven pressure compress a single link in your spinal chain. And when that link gets stiff, your brain sends pain signals to protect it, like a smoke alarm going off, even if there's no fire. That's why these 4 movements matter. They don't just loosen things up. They reattach your spine how to move, reconnect you to the muscles that stabilize it, and restore freedom where rigidity has taken hold. This is about retraining, not just relieving, and you're about to feel the difference. Exercise 1 prone, elbow press. How to do it. Lie face down on a firm surface like a yoga mat or carpeted floor. Rest your forehead down for a moment and breathe. Now slowly press up onto your elbows, keeping your hips and pelvis on the floor. This is a gentle back bend. You're not trying to push yourself high. Just lift enough to feel the spine extend slightly. Hold this position for 30 seconds while breathing calmly. If it feels too intense, lower down for a few seconds and return. Over time, you can build up to 1 minute and even add a gentle movement bend one leg at a time and slowly rotate it across the other. If this causes sharp pain, skip to the next exercise. But if it just feels stiff or mildly uncomfortable, that's often a sign your back needs this movement. The real benefit. Most people over 50 are taught to protect their back by avoiding movement. But your spine isn't a fragile twig. It's a living structure, and it's built to move. This exercise isn't just a stretch. It's a neuromechanical reset. We call it the reset position because it does exactly that. It reverses the effects of slouched sitting, especially the sagging posture that jams the lumbosacral joint into a locked, painful position. Every time you sit slumped, this joint is compressed, and over time, your body learns to stay in that state. This position gently tells your nervous system, we're going back to neutral. What's fascinating is how fast some people feel a relief, often in 20-30 seconds. Not because they're more flexible, but because their joint is finally allowed to breathe again. From a science perspective, this movement loads the spine in extension, reactivating spinal stabilizers, and reducing nociceptive pain-related signals from compressed tissues. But here's the deeper win. It gives you back control. You're not waiting on an adjustment. You're not relying on a stretch. You're restoring motion in the most fundamental joint of your spine, one that influences your hips, legs, and even balance. And when done daily, even just for a minute, this movement can quietly retrain your back out of chronic stiffness and into freedom again. Exercise 2. Supine knee rotations. How to do it. Lie on your back on a bed or firm surface. Bend your knees and bring them up so your thighs are vertical and your calves are relaxed. Keep your arms gently out to the sides for balance. Now, slowly, let both knees fall together to one side, only as far as feels comfortable. Don't force them to touch the bed. Then bring them back to center and go to the other side. Move in a slow, relaxed rhythm, side to side like a pendulum. Continue for about 30 seconds or until you feel a light release. For some people, the movement may only go halfway down. That's perfectly fine. The goal is to gently mobilize the spine through rotation, not to push range of motion. This is especially effective before bed or first thing in the morning when stiffness is most noticeable. The real benefit? Some movements don't just work your body, they reassure your nervous system that you're safe. This gentle side-to-side rotation does just that. We call it the gentle unwinding because it speaks directly to the part of your body that's been locked in protective mode for years. Think of your spine like a zipper. When the base is stuck, usually at the lumbosacral joint, the rest of your back can't move freely. Everything stiffens to protect that one jammed area. But this simple rocking movement nudges that joint into motion softly and rhythmically, like oiling a rusty hinge. More than that, it reintroduces rotational movement, something most over 50 bodies have lost from years of limited linear habits. Sitting, walking, standing. Rotation is the missing link. What's remarkable is how the brain responds. Your joints are filled with motion sensors called mechanoreceptors. When they detect gentle movement, they send calming signals to your brain, reducing pain perception and muscle tension. This isn't just about stretching. It's about neuromuscular communication. Every side-to-side shift tells your spine you're not stuck, you're moving again, you're safe, and over time, this resets your baseline. Movements that used to hurt become easy, morning stiffness fades, and your body learns to relax instead of brace. For many of my clients, this is the first moment they feel hope. Not because the pain is gone yet, but because they feel movement where there was only fear before. Let's move that fear out of your body. One breath, one swing, one moment at a time. Exercise 3. Bird dog with knee hover. How to do it. Begin on your hands and knees with your hands directly under your shoulders and knees under your hips. Gently tighten your abdominal muscles as if you're bracing for a light tap to the stomach. Now lift your right arm straight out in front of you. Thumb up while gently hovering your left knee about an inch off the ground. Hold for 5 seconds, then return to start. Switch sides. Left arm out, right knee hovers. Focus on keeping your torso steady. No rocking or twisting. Move slowly and with control. Repeat several times on each side until you feel mild fatigue 3 times a week. As you get stronger, you can progress to lifting opposite arm and leg together, but only when you can maintain perfect form and control. The real benefit. Here's something almost no one tells you. Your back pain might not be from weakness, you can see, but from deep muscles that have gone silent. The bird dog with knee hover doesn't just look simple. It's one of the most neurologically powerful movements for people over 50. We call it the deep core awakening because it wakes up your multifetus. It's a small but vital muscle that runs along your spine deep beneath the surface. After 50, especially if you've had back pain, your brain starts to turn off this muscle group. It stops firing properly, and that means your spine loses its internal bodyguards. That's when stiffness sets in and compensations begin. The body starts using the wrong muscles to do the job. But when you gently hover that knee, something amazing happens. You re-engage the stabilizers. You don't just move, you control movement. Again, this exercise taps into the concept of reflexive stability, the idea that the body can automatically protect itself through deep muscle activation. Once the right pathways are reawakened, think of it like flipping the circuit breaker back on. You don't need massive effort. You just need precision timing and awareness. And here's the kicker. This movement improves not just pain, but balance, fall prevention, and walking stability, all of which decline after 50 when these deep core muscles go dormant. You're not training for six-pack abs. You're rebuilding your spine's internal defense system. It's not about looking strong. It's about being stable from the inside out. And that changes everything. Exercise 4, standing hip circles. How to do it. Stand tall facing a wall, feet shoulder-width apart. Gently place your fingertips on the wall for balance. Don't lean on it. Shift your weight onto your left leg, keeping it slightly bent. Now, lift your right leg slightly off the floor and begin to draw slow, wide circles with your knee or foot forward, out to the side, around and back in. Go as slow and controlled as possible, like you're moving through water. Avoid rushing or swinging the leg. Do this for 30 seconds or until you feel a light fatigue in the outer hip muscles. Then switch legs. As you get stronger, try tilting your pelvis slightly outward during the top of each circle to increase activation. This motion targets muscles that are critical for keeping your pelvis level and your spine aligned, especially when walking, climbing stairs, or standing from a chair. The real benefit. You've probably never heard someone say, "My back pain got better because I worked on my hip circles." But that's about to change. We call this movement the pelvic compass because it reorients your body's internal GPS for balance, posture, and lower back stability. Here's the truth. The gluteus medius and other deep hip stabilizers are often overlooked. But when they weaken, which is incredibly common after 50, the pelvis begins to tilt with each step you take. That tiny tilt puts constant torque on the lumbosacral joint, the same joint you've been working to unlock in the previous exercises. And yet, most people never train these muscles directly. This movement is different. It challenges balance, mobility, and coordination all at once, activating the exact muscles responsible for keeping your pelvis level and your spine neutral. From a science perspective, it's a closed-chain balance exercise that retrains your proprioceptive system, the inner sense that tells your brain where your body is in space. When that system improves, not only does back pain decrease, but your risk of falling drops dramatically. And that matters because after 50 falls are no longer just slips, they're life-altering events. This exercise, when done regularly, quietly rebuilds your pelvic stability, postural control, and spinal alignment without needing fancy equipment or high-impact movement. It's simple, but it's not easy. And it's one of the most underrated protectors of your long-term independence. So, yes, your hip circles might just be the most powerful move you never knew your back was begging for. Expert advice for adults over 50. Here's what I want you to remember. You're not fragile. You're adaptive. Your spine, your joints, your muscles, they've all been adjusting to how you've lived, not how you've aged. That means change is always possible, not through punishment or pushing, but through intentional, intelligent movement. Start small. Just one of these exercises once a day done with focus can shift the way your back feels and functions. And most importantly, don't chase pain relief. Chase control. Because when you move with purpose, your body listens. And when your body listens, it heals. You came here looking for relief. But what you found, I hope, is something even more valuable. A way back to yourself. Pain can shrink our world. It makes us move less, trust our bodies less, and slowly start to expect less from life. But every time you choose to move with purpose, even in the smallest way, you're pushing back against that story. You're saying, this is not how it ends. This is how I begin again. These 4 movements may seem simple, but their impact is anything but small. They speak directly to the deepest layers of your nervous system, reminding your brain that your body is still capable, still responsive, and still worthy of care. So don't chase perfection. Chase presence. Let consistency, not intensity, be your greatest strength. And if you felt even a moment of relief, a breath of freedom, or just a little more hope than you had before, hold on to that. Build on it. Let it grow. Because you are not your pain. You are not your ache. You are a living, adapting, learning body. And the path back to strength is not behind you. It's right beneath your feet. Step by step, movement by movement, with compassion, with curiosity, and with the quiet courage to begin. This is not the end. This is the turning point. And from here, everything can change. This content is for educational and formational purposes only, and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or qualified health provider with any questions you may have regarding a medical condition. Never disregard or delay seeking professional advice because of something you've seen or heard in this video. The creators of this content are not responsible for any outcomes based on its use. Use these exercises at your own discretion and pace.